Hello everyone, my name is Basil Bamaga. Today I will be presenting on a very common yet clinically significant topic within the skeletal system, bone fractures. We will examine their structure, causes, types, and how our bodies completely regenerate broken bone tissue. Before diving into fractures, let's do a quick review of bone anatomy. Bones are dynamic living tissue. They consist of dense outer compact bone organized into osteons and porons, inner spongy bone containing trabella. Bones serve critical roles including structural support, protecting vital organs, and metabolic functions like mineral storage and hemostasis, which is blood cell protection. So, what exactly is a fracture? By definition, a fracture is a break into the continuity of bone tissue. This can range from a thin, microscopic crack to a complete separation of the bone. Bones break when the physical force applied to them exceeds their structural ability to absorb stress. There are three primary causes. 1. Trauma, sudden high force impact from falls, car collision, or sport injuries. 2. Overuse, repetitive stress over time, which leads to stress fractures, very common in athletes. 3. Disease, pathological fractures caused by underlying conditions like osteoporosis or bone cancer, which severely weakens the bone matrix. Clinically, we classify fractures into several categories based on their severity. First, we look at the skin's integrity. A closed or open fractures means the bone breaks but the overlying skin remains completely intact. The infection risk here is lower. An open or compact fracture is medical emergency where the broken bone pierces through the skin. This carries a very high risk of deep tissue infection and requires urgent surgical care. We also classify fractures by the nature of the break. A green stick fracture is incomplete break where the bone bends and only cracks on one side. This is highly common in children because their bone matrix is more flexible and less mineralized. A communicate fracture is where the bone literally shatters or breaks into three or more fragments. This is typically caused by high energy trauma and almost always requires surgical intervention to piece the broken bone back together. How do we recognize a fracture? An affected individual typically presents with sudden sharp, localized pain that worsens with movement. There is rapid swelling and bruising due to arterial bleeding, visible deformation or misalignment of the limb, and an immediate loss of function such as the inability to bear weight. To diagnose a fracture, a standard X-ray is absolute gold standard, though CT scans or MRIs may be used for complex joint movement. One of the most amazing features of bone is its ability to fully regenerate without leaving a scar. Healing follows a strict four-stage process. 1. Hematoma formation. Right after the break, blood vessels rupture and form a localized clot or hematoma, initiating inflammation. 2. Fibrocartilaginous callus formation. Fibroblasts and chronoblasts migrate to the site, creating a soft cartilage mass to temporarily bridge the broken ends. 3. Bony callus formation. Osteoblasts build new bone, converting the soft cartilage into hard woven spongy bone. 4. Bone remodeling. Over several months, osteoblasts sculpt the bone, replacing moving bone with mature compact bone, restoring its original strength. To ensure optimal healing, medical treatment follows a clear logical sequence. 1. Reduction. Relieving the broken bone ends, either manually, known as close reduction, or surgically through open reduction. 2. Immobilization. Keeping the bone completely still using casts, splints, or braces. 3. Fixation. For complex breaks, surgeons use external hardware like plates, screws, or rods to permanently stabilize the structure. 4. Rehabilitation. Finally, Physical therapy is essential to restore muscle strength, flexibility, and range of motion after the cast is removed. In conclusion, understanding fractures reminds us that our skeleton is not just static scaffold, but a living, highly responsive organ system capable of incredible self-repair. Thank you for your time, and I am happy to take any questions via email or our class portal Canvas. My name is Basil Babanga, and this is my presentation. Thank you.